Dr. Kathy Skinner, thank you for joining us today. We appreciate you taking time out from your practice to share with our viewers today. We're talking about prenatal health care, making sure mommies are in the best possible condition they can be during their pregnancy. How about someone you love finds out they're pregnant today? What would you tell them today, right out of the gate? Here's some things we need to think about. Here are some things we need to do.
First thing I would say is get an appointment with your doctor. So early prenatal care is vital to reducing the morbidity and mortality of mom and baby. If you need to start taking prenatal vitamins, if you haven't already begun taking prenatal vitamins, start those, especially prenatal vitamins with folic acid. If you smoke, quit. If there's any if you use any other substances, try to quit those as well. Optimize your chronic medical conditions. If you have high blood pressure, diabetes, thyroid problems, you need to get in to see your doctor even quicker to have those conditions optimized to decrease the risk of trouble during the pregnancy.
In simplest terms, whatever you do, whatever the mom does, the expectant mother does, she does to her and the baby, whether it's smoking or alcohol or any other substance that we just pray to God no mother would use illegal drugs during pregnancy. But I know that happens.
Absolutely.
But mommies need to know that you're not just doing this to your lungs, you're affecting that baby as well.
Absolutely. Babies that are born to moms who smoke have a higher risk of prematurity and low birth weight at delivery. They have higher risk once they're here of dying of SIDS, having chronic ear infections, lots of medical problems.
Lay people like me hear about someone getting pregnant and everyone's happy and the pregnancy goes great and they have their baby, but that's in a perfect world. That's when everything goes well. There are challenges all along the way, from the vitamins you mentioned, to diet, to exercise, to other things that make those happy endings happen. It's not an accident, correct?
That's correct. There are lots of places along a pregnancy where bad things can happen, from the very earliest moment of pregnancy until the very end. And those can be best managed with the help of a physician who is monitoring those conditions and looking out for those conditions.
Whether it's in the big city or in a rural area, do you run into some of the same challenges when you deal with women who have just found out their pregnancy on educating people about this? Because unless they had a really good health program or really good guidance from someone in their family, I'm guessing a lot of people start out with not a lot of knowledge about what they ought to do. Is that true?
That's true, and a lot of people don't realize how important prenatal care is and how important it is to be seen early by a physician to start treating these medical problems.
I guess these days a lot of women find out they're pregnant with a home test. They buy one and go home, and I guess they're pretty reliable, right?
Absolutely.
Once they say, oh my goodness, that turned the color that tells me I'm pregnant, you'd make an appointment as soon as you can, within days or even a week or
That's what I would recommend. For some women, that means obtaining health insurance and being sure that they have some way to pay for prenatal care, i.e. health insurance. For some women who already have health insurance, it's just a matter of getting in with a physician.
Are you able, and I know there's no perfection in medical care yet, but are you able to help women who from the start have physical challenges? You don't know if they're going to be able to carry the pregnancy to term. You're concerned about different health issues for the woman. Do you face those often, and what are some of the more challenging things that you have to deal with?
Sure, we have, women are able to get pregnant in today's great medical society. We take care of a lot of women that might not have been able to get pregnant 50 years ago, and now they're able to get pregnant. So we have to monitor those more closely. Sometimes the challenge is that they have had a prior pregnancy that had a bad outcome, an early delivery, a low birth weight. And so there are things that we can do, extra monitoring, extra testing, things that we do all along the pregnancy to help improve their chance for a good outcome.
Dr. Skinner, we appreciate your time today. Let's leave them with that, re-emphasizing that point. Just found out you're pregnant, find your doctor, find your the doctor that's going to care for you along the way. That's the bottom line best advice, right?
Absolutely. And that can be a family physician who does obstetrics or an OBGYN.
Very good. Thanks again for your time.
You're welcome.